By the 1920s, the coastal town of Eastbourne had become a sanctuary for Britain's wealthy residents to spend their final years by the sea. When Dr. John Bodkin Adams arrived in 1922, he quickly integrated into this community. In the mid-20th century, a local physician held a position of high social authority. Patients rarely questioned their doctor's judgment, and families typically deferred to physicians during end-of-life care. This combination of an aging, affluent population and the absolute trust placed in medical professionals created an environment where a doctor's actions could go entirely unmonitored. Over several decades, Adams' financial status changed significantly. Despite operating a standard general practice, he became known as the wealthiest medical doctor in England. Much of this wealth came from his own patients. Dozens of them had revised their wills in their final months, leaving him significant portions of their estates. Records show a specific chronological pattern. The alteration of a will was frequently followed by the patient's death. Despite these correlations, Adams maintained a reputation as a compassionate doctor who was present during his patients' final moments, a public image that diverted suspicion for years. By the time investigators looked closer, the growth of Adams' personal estate had mirrored the mortality rate of his wealthiest patients. The suspected method involved two stages. First, Adams used his medical authority to influence his patients' legal affairs, often isolating them while their wills were being drafted. Following these legal changes, he would administer high doses of prescription medications, including heroin and morphine. These drugs were used because an overdose in an elderly patient mimics the respiratory and cardiac failure often seen in old age. Because his patients were typically in their 70s and 80s, these sudden deaths were accepted as natural. No autopsies were requested, and no formal inquiries were made by the local coroner. Adams utilized a system where the symptoms of a lethal overdose and the natural process of aging were clinically indistinguishable. Eventually, the frequency of these deaths and the subsequent transfer of wealth became a topic of conversation among Eastbourne social circles. The investigation officially began in 1956, when authorities arrested Adams for the suspected murder of a patient named Gertrude Hullett. This map identifies 163 deaths that occurred under suspicious circumstances during Adams' decades of practice in Eastbourne. The Crown prosecution prepared for a trial they believed would expose a serial killer operating within the British medical system. The case would test whether the legal system could effectively prosecute a doctor whose primary weapon was a standard medical prescription. The trial opened at the Old Bailey in London in 1957. The prosecution struggled to differentiate between intentional overdose and aggressive palliative care. Without physical evidence that the doses were administered with the intent to kill, they could not prove murder. The jury ultimately acquitted Adams of the murder charges due to this lack of definitive proof. He was later convicted of fraud and medical board violations related to his financial dealings, but he remained free of any murder convictions. The requirement for direct forensic evidence in medical cases allowed Adams to successfully bypass the criminal justice system. Adams lived out the remainder of his life in Eastbourne as a wealthy man, eventually dying in 1983. His method served as a precursor to future cases, such as Harold Shipman, who utilized similar clinical settings and patient trust to avoid detection for years. Adams demonstrated that the high degree of trust society grants to the medical profession can be weaponized into a shield against legal scrutiny.